Our next 1.5 hours will be focused on endocrinology and technology. So our chairpersons for this session will be Dr. Sandeep Kar, Dr. Bimlesh Dar, Dr. A.K. Ajmani sir, and the speaker for this presentation, which is Patient in Cyberspace Information on Confusion, will be Dr. Om Lakhani and Dr. Chandani Seth.
So we have moved to the last session of this SPEEDCON. Very interesting talk. We know that patient comes to us with the knowledge of internet with them. Sometimes it becomes easy to make them understand, and sometimes it becomes difficult because they have pre-notified conceptions in their mind. So we have Dr. Om Lakhani and Dr. Chandani Seth to be speaking upon this, discussing about the pros and cons of this. I invite both the speakers to please start.
Thank you for the kind introduction, sir. And so in the next 20 minutes, we're going to talk about patients in cyberspace, information or confusion. And we are going to talk about the interesting phenomena of Dr. Google. Okay. So with me, we have Dr. Chandani Seth. Please, Chandani.
Good evening, everyone. So let's start with a case here. So this is a 45-year-old scientist who goes for a routine checkup, has a family history of diabetes, and he gets to have a RBS of 320 mg per deciliter. So here we see a patient who is well educated, he's a zoologist, so he has some background knowledge of physiology, of endocrinology, of medical sciences. So we'll discuss a case of an educated patient and how he reacts to it. So Dr. Om, what do you think are the factors that decide the use of cyberspace, and what can contribute to information or confusion in this cyberspace?
Yeah, so like you very rightly said, a lot of these patients are educated, right? They have the access to internet. They have some knowledge of physiology. They have some knowledge, We see all these patients all the time, right, in our practice. So when you seek information on cyberspace, there are two major sources of information. So if you see broadly, you have a source of information. In your sense, you will be seeking certain source of information based on your overall mental status. And there are broadly, two sources of information. So you have the credible source of information and not so credible information. So Chandani, can you tell us about what are the credible sources of information?
Right. So the first thing that comes to the mind is an experienced doctor who is specialized in that field. So that will be the most credible source of information. Then we have our medical textbooks and journals, and we also have some society guidelines depending on whatever disease the patient is going through. And of course, we have websites which are peer reviewed, and these are medical information for patients and for normal people, but these are peer reviewed. So Dr. Om, can you give us some examples of these credible sources? Are they available online easily?
Yeah. So one thing, I always say to my patients often ask me that, what is a good source of information online? So generally speaking, I always say that information where there is some sort of peer review or some sort of check and balance is a good source of information. For example, if I write something on my Facebook page, now I am an endocrinologist, right? I'm supposed to be knowledgeable on the topic. But if I write something on my personal Facebook space or on my own blog, that's information, but that is not credible information. But if I write something for Indian Journal of Endocrinology or Metabolism, if I write something for American Diabetes Association, right, it's always peer reviewed. It is checked by my peers of my own field, and that, there might be certain things which might not be right, which will be corrected. So whenever you seek information, information should always be cross-checked and peer reviewed. And unfortunately, patients are not able to differentiate between what is a credible information versus what is not credible. For example, in this patient, what could the patient have done with his time? He could have probably done a teleconsultation with an endocrinologist. he could have probably looked at PubMed. Now he's a zoologist, right? He has access to some medical research. He could have looked at PubMed or maybe Up to Date, which is a source of information. He could have looked at the American Diabetes Association website, right? You have the society websites which give information. Any disease you take, if you have thyroid problems, you can look at the American Thyroid Association. You have the Indian Thyroid Association, right? Same way, the patient could then have looked at peer-reviewed websites. For example, you have something like WebMD or MedlinePlus.go. These are all peer-reviewed. If you know, Medline Plus is basically run by the same institution which runs PubMed, right? That is the National Library of Medicine, right? So they have PubMed, which is for doctors or for healthcare professionals or for experts, whereas on the other hand, you have a Medline Plus, which is for general public, right? So these are some credible sources of information. So then, Chandi, which sources of information are less credible? So we talked about credible, but then patients also often lay trap to things which are not credible. So can you give some examples of less credible sources?
So the first thing that patient does is look for their family doctors or at times doctors who are not specialized in that particular field. These could be Ayurvedic, homeopathic or any alternative medicine practitioners, and they may not have knowledge on that specific field. So that would go into the less credible source. And I think the commonest is whenever they hear a disease and they say, oh, so and so person had that disease, so maybe I should speak to them that what do we do about this. So patients tend to trust their own people or relatives or friends or neighbor more than their doctor. So I think those are some less credible sources. Again, if we look at the lay media, we look at the newspapers and we see multiple health information being given without giving credit to who the author of that article is. So lay media is all around and patients get more relatable content there, I think. And one of the biggest thing that that's happening is the social media bloom. So we have influencers, we have people who have million followers. So patients will relate more to them and they won't understand that these are less credible and they're not specialized in that field. But these are, I think, they are more influenced by YouTubers and influencers and all these social media posts today. So let's move on to the second thing that Dr. Om mentioned was the mental state. Now, of course, we look at the sources of information that are available, whether it's credible or not credible, but how does a patient's mental state affect your search history or results?
Very true. So look, we are all human beings, right? We first need to acknowledge the fact that we are all same, right? Now, if I suffer from a disease where I am not specialized in, I might also do what my patient here is going to do. So one thing which is there, so there's a big difference between what has happened in the past and what's there at present. In the past, information was always fed to you, right? So आप newspaper पे ad सुनते थे, आप मतलब TV पे ad सुनते थे, radio पे ad सुनते थे, or you were reading ads or you're reading articles in newspapers or magazines. Everything was given to you. There were gatekeepers who used to filter, right? You still have, the films where you have the censor board which tells you कि क्या देखना चाहिए, क्या नहीं देखना चाहिए. But what internet has done is it has, for good or bad, democratized the system where now there are no gatekeepers, right? You can always find what you're looking for, right? You search for something, you'll find it. I bet you any disease you take, right? Find any disease and any form of therapy and combine the two words together and you'll find some article on that, right? So you'll almost always find what you are searching for. So you should always look at what is the right thing you want to search for. That's more important, right? Okay. So moving ahead, yeah.
So can you give us some examples for how the patient's mental state will affect their cyberspace journey?
Yeah, absolutely. So, one very important thing is, and when we look at overall how we all behave, there is something called stages of grief, right? So whenever you're dealing with some challenge in your life, right, you always go through these stages of grief. So you have the stage of denial, then you go to a stage of anger, bargaining, depression, acceptance, right? So these are the various stages we all go through, right? A friend of mine, mother recently had leukemia, right? She's still going through right now, she's going through the denial stage, right? So there's always that stage which you go through, and as independent people, you recognize that. But when you're living through that, you don't realize what you're going through, right? So patients often look for, in cyberspace, things which they are going through in their life, right? So some patient in a denial stage will search accordingly and so on and so forth, right? So, Chandni, so first stage is the stage of denial, right? A lot of patients always go through that stage of denial. नहीं, मुझे तो cancer नहीं है, मुझे तो diabetes नहीं है, मेरा diabetes ठीक हो जाएगा, right? So, can you, what kind of things people search for when they look for denial?
Right. So these stages of grief, they may be fluid. One may come, I mean, it's not necessary that it comes in a chronological order,
Yeah.
but the denial part is usually the first stage where they're not accepting that they have a disease. Like our educated patient here did not have any symptoms, so it's hard for him to accept that I don't have any symptoms. So in the real life we see they'll get tests done from 4 different labs to confirm whether their sugar is high or not. So they'll search their pages, and first question will be, do I have diabetes? What are the symptoms? Because they'll say, oh, I don't have weight loss, I don't have polyuria, I don't have diabetes, I don't have any nerve problem. And they'll try to search what is high. So is 300 high? What is normal? What is not normal? And they'll go into, when you talk to your patients about insulin, they'll talk about types of diabetes. So they'll search, okay, type 1 is the one with insulin, but doctor said this is type 2. Why is he giving me insulin? Is it dangerous? Is it not? And as sir mentioned, that whatever you want to find on the net, you can type in it in that way. If you say, I don't have diabetes, I don't have symptoms, you will search it like that. So in the phase of denial, you will search for things which tell you that you don't have diabetes.
Yeah, this is what is known as confirmation bias, right? So you always look at things, which confirm to what you believe in, right? Yeah.
So, so can cyberspace help such patients who are in denial?
Yeah, so I think I would be in denial to say that, everything in internet is bad. In fact, it's not. So if you look at the recent Google algorithm, actually the algorithm has been updated so that whatever information you get these days, at least the information on the top is always credible sources of information. At least Google is trying to do that, right? But they say that how do you hide a murder on internet? They say you put it on the second page of Google, right? So most of the time, whatever you want to find, it is there on the first few links of Google, and generally it is credible information, right? However, remember the fact is that Google will tell you what you are searching for, and we come back to this point again, right? If you're looking for what is diabetes, it will give you the top reference from American Diabetes Association saying what is diabetes. But if you look for diabetes is fraud, diabetes is fake, then you will find accordingly, right? You will find some Baba's information which will tell you that nahi, ye sab galat hai, right? So that's why it's very important to know what you're looking for. Now moving on, we move from the stage of denial to stage of anger. And what happens in an anger stage? Chandni?
Right. So now the patient has some idea that they might have diabetes. So they become angry, they'll be frustrated, they'll start playing the blame game, they'll blame God, they'll blame themselves, and then they'll find out ways to vent out this anger. They may go on the social media, they may look for other posts like that, or they may post like that, and they're very vulnerable at that time to accept whatever is coming their way. So, yeah.
Yeah.
So let's listen about what happened to our patient next.
Yeah, so this is a real patient. So what he did, he started losing weight. He went to the anger stage and, went on Facebook and started posting something, He was a friend of mine, so, accepted a lot of things which came. But then the disease does not stop, right? Reality does not change. He started losing weight. He started having symptoms of weight loss, polyuria, polydipsia. He consulted an alternate medicine specialist. Remember, the disease does not lie, right? It continued to progress. This is what happened to the patient, right? And then when he finally came to a specialist, right, that point of time his HbA1c was 13.5, fasting sugar was 300, post-meal was 500, creatinine was 1.9. In short, urine ketones positive. The patient came in a bad state. He remained in a state of denial and anger for a long period of time, right? Visibly dehydrated. So at this point of time, what happens next to such patient, right?
Right. So then comes the stage of bargaining, where he'll first start bargaining with you that why are you admitting me? 2 months back you told me take this medicine or take this and go home. Why are you admitting me now? Why insulin? Give me maximum oral medications that you have. And so on, they will bargain to find out the easiest way. They'll bargain with us, they'll bargain with God, and they'll go through this stage where they'll ask for an easier punishment for them.
Yeah.
So in the cyberspace, how does this appear, this bargaining
Yeah.
stage?
Very rightly said, often people bargain with God, remember, nature or God does not change, right? So this is the bargaining stage, and this, this is the WhatsApp stage actually, right? This is where the patients, go out to, doctors in the family, second opinions, they reach out to non-medical friends. Again, they are extremely vulnerable to misinformation at this stage. Kuch misinformation is waqt aa gayi, right? Patient is in a bad loop, right? For example, we had a patient with congenital adrenal hyperplasia, right? We started the patient on glucocorticoids, life-saving medication, right? Young child, 12-month child, right? And patient went to a neurosurgeon who was a doctor in the family. He said, "No, steroid period ban kar do." Patient ended up in crisis, right? So it's a vulnerable stage. Patients, often seek opinion from doctors in the family who may not be so much aware about that disease in particular, right? So again, patients are often victims at this stage to alternative therapies or maybe perhaps misinformation at this stage, right? So what happens next, right? So now the patient has
Right.
gone through all these stages. What would be the next stage?
So then now the patient is admitted or treated or starts treatment with insulin. So at that stage, patient goes into depression. He realizes, now he starts to blame himself that why didn't I agree with the doctor earlier? I have delayed and I have reached such a stage in the hospital. So the patient at this stage may become withdrawn, may lose interest in everything. So he may not reach out to the cyberspace at this stage.
Yeah. So this patient often, gets to a stage where, he goes completely offline, right? I don't want to, on one hand, this doctor is saying this, the other doctor is saying this, the patient is completely off, right? Said, "Mujhe kisi ki baat nahi sunni." He goes to the stage of recursion or depression rather.
Right. So what happens next? Is there a happy ending?
Yeah, thankfully, of course, we had a happy ending in this patient, Eventually, there is the stage of acceptance, right? The patient accepts the disease, goes back to the specialist. This is what happened to the patient, accepts whatever treatment was there. In cyberspace, then, of course, there is the other way around, right? Starts giving glowing reviews to the, Google My Business page or on Practo or something, And I often believe that sometimes even these glowing reviews are misleading, right? No doctor could control my sugar, but I went to this doctor and he controlled my sugar, right? Now, fine, that may be true, right? But then at the same time, do not put your doctor at a higher pedestal where, again, it may not be true for other patients, right? So that is what often happens. Patient then goes into a different stage where, he starts praising whosoever people helped in the right way, right? But then again, that also may be misinformation for some other people, right? So we need to also keep that in mind.
Right. So what tips can we give so that one avoids being trapped in this web of confusion?
Right. So 5 tips, right? Share it with your family members, right? We all share a lot of misinformation. Let's share some correct information. So 1, metacognition. This is a very important concept. Remember, always step back and reassess your own clinical situation, right? Your own, real life situation. Understand your current mental state. Understand that you might be often sometimes, having some sort of a bias, right? So step back and reflect upon your own mental status, and that often helps you in your own life, no matter what you do, right? Whether you are suffering from a disease or whether you're doing through something else. Second is, very important, understand what is known as Dunning-Kruger Effect, right? Very important. Does anybody know what's Dunning-Kruger Effect, right? It's basically somebody who has less information often feels he's much more information, he has much more information than what reality is, right? They always say that empty vessels make more sound, right? Sometimes, some patient reads up about something on diabetes and feels that now I'm an expert of diabetes. But the more you read about it, the more you realize how ignorant you are of the disease, right? And this is what is known as a Dunning-Kruger effect, right? And patients, and often a lot of us also, human, as doctors also, we need to understand that we need to assess in a broader sense, and rather we, should not fall trapped to the Dunning-Kruger effect.
One of the things is cognitive bias. So it's not just the patients, but I think we all also suffer from this kind of cognitive bias, where we go by our intuitive learning or our experience and, fast, irrational decisions in the OPD that happens to us. At times, we choose experience over evidence. So I think cognitive bias, first, we need to face our cognitive biases and go for an analytical approach. And there are de-biasing strategies. There is cognitive educational therapy, motivational, then there are technological tools, artificial intelligence. Dr. Om has many apps which can help us. And of course, even for the patient who is reading something online or who is listening to the experience of other people, this cognitive bias can hamper and lead us to a wrong path. So we need to face this with some analytical mindset.
Very important, of course, what is known as root cause analysis. Always ask 5 whys, right? Why? Something happens, why did it happen? Why did that happen? Why did that happen? Often, by asking 5 whys, you're able to understand the root cause of a problem, right? Of course, this is also used wrongly by a lot of alternative medical patients, but let's not get there. But always do a little bit of root cause analysis whenever you're dealing with a challenge.
Right. And the last thing is to trust the experts, the real experts in that specific field. And second is any peer-reviewed sites or papers that you can find. But social media is definitely not a credible way to look for health-related information.
Thank you.
So very well conceptualized, and it is very pertinent to look for articles which are peer reviewed.
Yes, sir.
Because we are facing a lot of problem in this era where people comes with preconceived conceptions in their mind, and then they argue, especially with high risk disease like leukemias and cancers. Thank you, Dr.
Thank
Om.
you, sir.
Thank you,
Thank you
Dr.
so much. Thank you.
Chandani.